Venous drainage of the lower limb is divisible into two components: superficial venous drainage and deep venous drainage. The two eminent veins which are superficial venous drainage are the great saphenous vein, this one, which is running throughout the lower limb, right from the foot up to the knee joint, and then continue upward through this saphenous opening, great saphenous join with femoral vein. This is the one vein which draining. You can see this vast area on each side, the thigh. These are the communicating tributaries of these veins, which bringing the venous blood and drain into the great saphenous. Similarly, from other side also veins are coming. These are the from the medial side, medial set of veins which drain into the great saphenous. Similarly, on the medial side of leg veins, they are draining into this great saphenous, and the long lateral veins, a lot of lateral veins from the leg that is drained into this. It is the longest vein in the body and start from the venous plexus present on the foot. On the foot you can see from the digits there are the very small veins which collect blood from the digits. These veins not only collect this dorsum of foot but also from the plantar side through this one is that is shown communicating vein. Veins also communicating with the sole side veins or the plantar side veins, and they form a dorsal venous arch finally. So digital veins, these are the small digital veins which form an arc-like structure, which is the dorsal venous arch. The medial half, this medial half of the dorsal venous arch that join to form the medial marginal vein. This one is the medial marginal vein, and this medial marginal vein continue in front of the medial malleolus. So we can give an IV drip or the granula can be passed, and we can put the drip or the if the vein is not available on upper limb due to dehydration conditions. This vein is very prominent in front of the medial malleolus. Then it passes upward on the tibia side medially upward to the knee joint, and behind the knee joint, it slightly behind the knee joint, then it again curve upward medially and continue to the saphenous opening and join the femoral vein. This vein has the valves in it to prevent the downward movement of the blood. So this vein is also used for bypass surgery in the heart. A piece of vein is taken and then put into the heart as a bypass surgery, because this is a smooth vein and the between the valves a piece of the grafting is done. So you can see this vast area of the front of thigh and the lateral side of thigh, superficial, not deep, is drained into this great saphenous vein. Deep veins are similarly, that is the here is is the dorsal venous artery and arcuate artery. The arcuate veins start here along with that is not shown over here, but it continue as a dorsal vein then continue as anterior tibial vein over here. Similarly, posteriorly, the collection of blood from the foot from the posterior tibial vein both combine in popliteal fossa and then form the popliteal vein. Popliteal vein then continue above through the ductal canal as femoral vein, which continue in the pelvis as external iliac vein. This is the D veins, which you see in the venous drainage. So venous drainage of the upper lower limb is rich venous drainage because it is a locomotor organ and movements occur on the lower limb. The follow along with this great saphenous is the saphenous nerve, which supply the medial side of the foot. It is it's in the saphenous nerve which is continue on the medial side of the foot. Follow these. So what is said that if injury take place in MCQ or near the great saphenous, which nerve is damaged? That is the saphenous. The great saphenous before entry into the femoral vein drain superficial external pudendal vein which enter in it, and the superficial external pudendal vein drain the scrotum and the external genitalia. Superficial epigastric vein drain from the hypogastric region or below the umbilicus region into the great saphenous, and the another is the lateral edge. What is shown is the saphenous opening. Then the superficial circumflex vein number 3, which drain into great saphenous or directly into femoral vein. So 3 veins are joining over here: superficial circumflex, iliac from the anterior iliac spine along with the uh, ilium bone of the hip bone, and area above that superficial, then superficial epigastric from this hypogastric region below the umbilicus, and the superficial external pudendal which drain from the genitalia, and other veins from the thigh and the knee joint and the leg, superficial veins and the foot. They all drain, forming the medial marginal vein, this one, which continue as great saphenous. On the back, there is another great vein, which is the small small saphenous vein. This you can see. This also starts from the lateral half of dorsal venous arch. What we said, the medial half of the dorsal venous arch continue as medial marginal vein and then great saphenous. Lateral half of the D venous arch, dorsal venous arch, lateral half, and the veins from the lateral side of the lateral toe, they combine to form this lateral marginal vein, this one. It continue above as small saphenous vein. It drains the rest of the posterior aspect of the leg. You can see many tributaries which are this one opening into small saphenous. From the medial side of leg, this one great saphenous drain the anterior half of the leg and thigh. The posterior half is drained by this medial side by the small saphenous, by these many communicating veins, and lateral half of the leg posterior aspect drain into the small saphenous vein. Small saphenous vein join with finally with the popliteal vein. This one is the popliteal vein which the small saphenous join. We start with the veins of the lower limb. Number one is the superficial group, subcutaneous in superficial fascia. It is the below the skin, superficial. D veins below the D fascia along the arteries, that anterior tibial, posterior tibial, femoral artery, like this popliteal artery. They follow along with that artery. That is the D group. Both veins have valves more than upper limb because blood is passing anti-gravity. So need of the stability to run upward, and valve provide that. Superficial vein, dorsal digital vein, which I told you that veins of the digits receive at clefts rami from the plantar digital veins. So dorsal digital vein, I told you that join with the foot, the sole of the foot are plantar digital veins that join with that to form the dorsal metatarsal veins that form the after joining digital veins in between the metatarsal bones, that is form the metatarsal veins, which are united across the proximal parts of the proximal part of the metatarsal bones in dorsal venous arch, which I shown in the diagram. Dorsal venous arch is formed. How the dorsal venous arch is formed? By digital veins which communicate with the plantar veins, and then they continue as metatarsal vein. Metatarsal vein then form the dorsal venous arch. Proximal to it, before that, in dorsal venous network, receive the receive the tributaries from the D veins, that receive the tributaries from the D vein. Continues with the venous network in the leg. At each side of the foot, this network connect with or form medial and lateral marginal veins. So I told you medial half of the dorsal venous arch form the medial marginal vein, lateral half of the dorsal venous arch, and along with its tributaries form the lateral marginal vein, formed by the veins from the superficial part of the sole. In sole, superficial vein form a plantar cutaneous arch, that is also arches formed in the sole across the where roots of the toes, that is the where the toes start. At that level, a venous arch is formed in the sole. Medial and lateral marginal veins, that is joined with medial lateral plantar. Proximal to the plantar arch, a plantar cutaneous venous plexus drain into marginal vein. So this all detail is that the small digital plexus, metatarsal veins, they ultimately form the median and lateral marginal veins. Great or long saphenous vein, it is the continuation of the medial marginal vein, which I told you medial half of the dorsal venous arch, and tributaries on the medial side to form a large vein on the medial side of foot, medial marginal vein. It continues as great saphenous and into a femoral vein, and it is the longest vein of the body. It starts 3 centimeter anterior to the medial malleolus. So where you locate this vein, follow the medial malleolus, and almost 1 inch in front of that or 3 centimeter in front of that, you can easily palpate this vein. So when you want to give IV injection, drip or granula, you can locate it almost 1 inch in front of medial malleolus. Cross distal one-third of medial surface of the tibia. It is on the medial side of tibia, obliquely to its medial border, a little behind the knee. It passes behind the knee, little behind, posteromedial to the tibial femoral condyle, posteromedial, posteriorly and medial to the tibial femoral condyle. So you can see from here above detail that it passes in front of medial malleolus, but it is bit behind the knee joint, tibial femoral condyle, posteromedial to the tibial femoral condyle. Then medial aspect of the thigh, then again become on medial side or front, enter the saphenous opening into femoral vein. Great saphenous is very important SCQ in university questions, which is only separately asked. Write about great saphenous vein. Its significance. Significance is it is used in bypass surgery. Enter the saphenous opening into femoral vein. The center of opening is 2.5 to 3.5 centimeter of this opening is infralateral to pubic tubercle. Infralateral to the pubic tubercle. It has 10 to 20 valves in it. Yeah, in it. That is the thigh. So, many times this MCQ is asked how many valves are present into great saphenous. 5, 6, 8, 10, 20. So 10 to 20 is correct, or 15 is also correct. Valves, that is more in leg than thigh. More in leg than thigh. Tributaries of the great saphenous vein. It drains the sole via medial marginal vein. In the leg join with, I told you in diagram that join with small saphenous and deep vein. It joined by tributaries, not directly joined with small saphenous, not through the tributaries from the great saphenous continue to the small saphenous also. So if great saphenous is blocked, then blood can pass below the knee joint through these small tributaries to small saphenous. Small and great does not join with each other but by the branches. And D veins at knee, three large tributaries, that is number 1 from the front of leg, number 2 from the tibial malleolar region, that medial malleolus, number 3 from the calf back. In thigh, it receives many tributaries. These are group number 1, posteromedial tributaries, posteriorly and medially, the tributaries which drain into it. Number 2, anterolateral tributaries, anterior and lateral side. And number 3, periinguinal veins from the inguinal ligament or periinguinal. Posteromedial veins drains superficial region. Anterolateral group commences from the anterior network in the distal thigh. Great saphenous vein also join superficial epigastric vein. Number 2, superficial circumflex vein, which I shown in diagram, and superficial external pudendal vein. 3 tributaries join with the great saphenous before it terminates into femoral vein. Number 1, superficial epigastric vein. Number 2, superficial circumflex vein, and superficial external pudendal vein. The number 1 and 2, which is the superficial epigastric and circumflex, that drain the lower abdomen. whereas the number 3 drain part of the scrotum. Small saphenous, second largest vein in the superficial venous drainage of lower limb. Small saphenous or short saphenous vein start anterior to the lateral malleolus. Continuation of the lateral marginal vein. Lateral marginal vein, which I told you, lateral half of the dorsal venous arch and tributaries combine to form the lateral marginal vein along the lateral side of foot. Then this is continue as short saphenous or small saphenous. In lower one third of calf, it ascends lateral to the tendocalcaneus. It is lateral tendocalcaneus. These locations are important because if you want to give IV or vein is not available, one must know the localization of the veins. This is very important. This is the difference between the doctor and non-doctor. The doctor knows that where is the location of the vein, exact what is its relation with the malleolus, what is its relation with the tendonculus. So he can put IV drip or injection there, as compared to non-doctor doesn't know. And that know where is the vein available or seen, and that put the injection, but not exact localization. In lower one third of calf, it ascends lateral to tendocalcaneus, pass medial to the midline of calf, enter the deep fascia, within which it ascends on the gastrocnemius, that ascends on the gastrocnemius to approach within which deep fascia, enter the deep fascia, within which it ascends on the gastrocnemius to approach the mid one third and upper one third junction between the between the between the heads of the gastrocnemius, and popliteal vein. So great saphenous terminate into popliteal vein, small saphenous drain into popliteal vein, whereas the great saphenous drain into femoral vein. 3 to 7.5 centimeter above the knee joint in popliteal fossa. Tributaries are joint deep vein on the dorsum of foot, and cutaneous tributaries from the leg also join the great saphenous. It contains 7 to 13 valves. Deep veins of the lower limb that accompany the arteries and their branches. There are numerous valves. Plantar digital vein arise from plexus in the plantar region of toes, connect with the dorsal digital vein, unite into 4 plantar metatarsal veins. The digital veins join to form the plantar metatarsal, similarly like on the dorsal side. These run in the intermetatarsal spaces, connect with by perforating vein by dorsal vein. These are communicated with dorsal vein by perforating veins. Perforating veins are those which cross from sole to the dorsum of foot and join the two plexus with each other. They are bridging that bridge in between the two plexus. Dorsal plantar venous arch to dorsal plantar venous arch. Plantar venous arch accompany the plantar arterial arch from this medial and lateral plantar vein. There are two. You know there are the two plantar arteries, medial and lateral plantar arteries. Similarly, the corresponding vein name is given. The medial and lateral plantar vein run with corresponding arteries, and after communicating with the great and small saphenous vein, form behind the medial malleolus the posterior tibial vein. So these ultimately form the posterior tibial vein along with the posterior tibial artery. Posterior tibial vein accompany the posterior tibial artery and connect with the popliteal vein. Anterior tibial vein, continuation of the venous companions of the dorsalis pedis artery between the tibia and fibula at the proximal and interosseous membrane, unite with the posterior tibial vein and form the posterior tibial vein, which further continue as popliteal vein. Popliteal vein ascend through the popliteal fossa to an aperture in adductor magnus and form the adductor magnus form the femoral vein. Tributaries of the small saphenous vein is the tributary of the popliteal vein corresponding to the branches of popliteal artery, that is genicular branches which supply the knee joint, corresponding genicular veins, and muscular veins. Popliteal vein, 4 valves present. Femoral vein, which has 4 to 5 valves, accompany its artery, begin at the adductor opening with the continuation of the popliteus and end posterior to the inguinal ligament as external iliac artery. So femoral vein continue as the external iliac vein rather, because it follow the external iliac artery and its name is external iliac vein. It accompany the middle component of the femoral sheath. It occupy the middle component of the middle compartment of the femoral sheath. Tributaries many muscular branches are the veins formation and the great saphenous vein.